If a person is having hemoptysis, your differential should look something like this. To help you remember this list, here's a mnemonic I used as a student. Just to remember, there are 2 B's in battle and 3 A's in camp. B stands for bronchitis and bronchiectasis. A stands for aspergilloma. T stands for tumor. The second T stands for tuberculosis. L stands for lung abscess. E stands for emboli, as in pulmonary embolus. C stands for coagulopathy. A stands for autoimmune disorders, AV malformations, and alveolar hemorrhage. M stands for mitral stenosis. And P stands for pneumonia. So the next time a patient presents with hemoptysis, just remember battle camp.